So, do you mind telling just sort of what got you into the topic of autism?
Sure. Well, and I think I saw your ad on the Next Door thing on Facebook, and I went, oh, this is a perfect opportunity to get the word out about autism. So I am the director of the Central Coast Autism Spectrum Center, and we've been in operation for about 10 years. And I got involved in this, was one of the founders. I have 2 kids myself who have autism. One fairly moderately affected, one very mild, and they're now adults. And so at that point, there were a group of us just wallowing in the system of autism in the schools and regional center and just all of that what that entails. And it's kind of a 24/7 ordeal. And there were no resources really other than, the agencies, and that was great. But, boy, we're trapped at home. We can't leave. We're, isolated. There's nobody to talk to, and really hard to leave the house. So we started the Autism Center initially with 1 month a parent support group, the next month an outing. Then we would do things where parents could come together and kids could just be kids, and you didn't have to explain. And if somebody had a meltdown, who cared? We've all seen it before. So we started with that, and then it evolved into the Autism Center now. And we've had some phases of growth. And right now we're kind of in another one of those. We're in another one of those
phases. You need to hand out a card to somebody.
We're in another one of those phases of we started there, then we implemented a bunch of programs, and we did a supported employment pilot. Then we kind of backed off. We kind of bit off a little bit too much, kind of stabilized. Now we're in that period of growth again, going, what can we do past what we've been doing? And
so it was 2006 when you got started, right?
Right.
And did you have a center right away, or was it?
No, it was literally Becky Dornelis and I, who's in the community. She has worked for Parents Helping Parents. I'm a pediatric neurologist, and dealing with 2 of my own kids with autism, people go, oh, that's why you became a neurologist. No, that was not. So that was not in the game plan. And so I kind of looked at her and went, everyone at Parents Helping Parents, I have this giant Rolodex of every single person in the county related to autism and know them all. No, if other people had these resources, still we were drowning, knowing everything that was available, knowing we need this, hey, why don't we just make that happen? So we started with a website only. Then we eventually moved towards, we tried to have a physical center, but it was just a waste of $1,000 a month in San Luis because we didn't have any foot traffic. Then we pulled back. We work out of the Spokes Nonprofit Center. So for the most part, we're putting on events. Most are at Meadow Park, the community center. We do teen dances. So we are renting venues at nonprofit rates, which are really low. So everything we raise then can be used to implement services for people, which is really the stuff that doesn't exist, which is parents getting together, ability for individuals to socialize, young kids, older kids.
So you're building a community.
We're building a community, right.
And I'm going to go so I should throw this out there. Anytime you want to ask a question, ask it, How many people here are directly connected with autism, and how many are here for the tea? Okay. For both, okay. All right.
Well, I was here for the coffee.
All right.
How that went.
Sorry. All right. So, get her a coffee. Just get. So, what do you think is the most? What has the most impact? What's the most helpful thing for people with autism?
So
is it just having the social network?
I think it's the resources for families and individuals. So I think parents being able to connect with one another, hear what somebody else is doing, find out what ABA provider they're using, or what is everyone else
ABA
doing?
Means...
behavioral services. So there's all these things out there that might help. Well, we've tried them all. And we used to call it guilt money. We'd throw guilt money at it. Well, and folks would tell us, this for sure will fix this problem, or it'll fix this problem. Anything we did personally had about a 10% benefit. We had in-home behavioral services. We did everything. But all those little bits added up over time. The things I regret as a parent of individuals with autism is not trusting my own gut judgment more of, if it didn't look right to me, you know, oh, we swear this is the way and this is how it's done, and that now, no, absolutely not. So that gut sense as a parent to be able to go, this doesn't feel right to me. This doesn't look like what we should be doing. This doesn't look appropriate. And so I think parents being able to be a sounding board to one another of, hey, what do you think of that? No, that doesn't sound right. Or, oh, this is great. Have you heard of it? Just being able to make that connection with one another, because you're out on this island. There's all these things out there that might be helpful, and you read all this stuff on the internet, and you know, where do you start?
So for your 2 kids, what was most useful?
I think the thing that's most useful for any child and any family is to keep your sanity about the situation as much as you can, and try to get everybody on the same page, and to really just get a reality check, get your own mental health in order, because this will push you further than anything has ever pushed you. And so to get both parents as functioning as well as they possibly can. They talk about the stress of parenting autism like being in a war zone, and that really is what it feels like sometimes. So the level of difficulty can be 24/7, and it is this continual reaction. Or, you know, we were doing behavioral services with every 10-minute behavioral ratings. So every 10 minutes, rating the behavior, giving a feedback, rating it with both kids. I think we did 3 months. We had 3 months of data at one point. Like, I've done this for 3 months. This is insane. But does it change behavior? Is it worthwhile? You know, and so really just knowing that other people are going through that too.
And so while you're implementing some change, I mean, how do you differentiate sort of kids just growing and getting older and evolving out of a behavior? Right. I mean, how do you separate?
So, and for the most part, because parents are often asking that, well, how do I know what's normal and what isn't? Often, you know, because the relatives, oh, that's my kids did that. Oh, you know, somebody's done that before. Kids do that. It's the frequency and severity of the behavior. So I remember my son having tantrums. Okay, he's 2, 3, he had tantrums. But I remember going to the neighbor, God, my son's having tantrums. There's like 10 a day, and they're lasting like an hour. Oh, my kid's not doing that. Oh, I mean, 2-year-olds have tantrums, but this is different. And trusting your gut and what other people say, and but then, you know, you get this false sense of security. You go to whoever's house, oh, yeah, kids do that. You just need to do this. I had in one day, 2 different providers told me. One had told me, you need to spend more time with him. And then another told me, you spend too much time with him. That's what's wrong. You know.
So what age are the kids usually diagnosed with autism?
So it used to be when I moved to this community.
What do you say, autism? On the autism
spectrum, or it used to be when I moved to this county that the typical age for a child to walk into my office with autism was 5, believe it or not, and now that's like unheard of. So severe autism, limited verbal skills, limited eye contact, you know, just clearly having classic autism was not picked up till 4 or 5. It was shocking at that point. I never see that. Actually, I think I've seen it once recently. But you don't see that anymore. Now we're picking up the signs, and some of the signs people don't, you know, I had a mother today who I saw, oh, I didn't know that meant something. So not pointing to show you something, joint communication. And again, not all kids have all of this.
Excuse me, can you guys speak a little louder, like in the back?
Oh, I'm sorry. You couldn't.
Oh, sure.
Yeah, I just want to make sure everybody can hear you well.
So the signs of eye contact, joint understanding, so that as a child, I would want you to know that, hey, there's a fire truck over there, and I want you to see it and tell me what you think of it. That is, so if there is that aspect of development that seems impaired, those are huge red flags people don't realize. Communication, being able to use language rather than just repeat it. Sometimes there's repetitive behaviors. You know, often kids are lining up toys just amazingly beautifully, organizing them, and you know, oh, okay, I'm a little OCD. My kid's a little OCD. It's a red flag for autism. Doesn't mean they have it, but if you have enough of those features and enough issues, yes, those are things you need to get checked out. There's a CDC handout over there that talks about what are the signs of autism at different ages. And I remember my son, when he was born, I remember holding him, nursing him. I'd look down, he'd look away. Oh, that's odd. And my mom, who's here, she's a NICU nurse. That's strange. Yeah, that is strange. Oh, he'd look away. Clearly, gaze aversion as an infant. That wasn't an autism sign then. You know, I'm a neurologist going, that's strange. I don't know what that means. But it's odd. And so if something seems odd to you, and it seems out of the norm, bring it to your pediatrician. And pediatricians have gotten so much better at this now.
So actually, so pediatric neurology equals you do medical school, then pediatrics, and then specialize in neurology, or neurology first, then pediatrics?
So it's medical school, then pediatric residency, then adult neurology, a year of adult neurology, and 2 years of pediatric neurology. So it's a child neurology fellowship after pediatric training.
And you graduated from that in which year?
97.
So was it a topic
No.
during residency? Or
No.
not
So
much?
as a neurologist in the 1990s, autism was classic autism. So at that point, if you had the training, I trained at UCLA, good medical school, the training on autism we had in medical school was they brought a child in. I don't know whose poor parent got to do this. Sat the child on the desk in a lecture hall of 300 students. Child was doing something. They banged some pot and pan behind the child's head. Child did nothing, did not react at all, and said, see, this is what autism looks like. Okay, that was it. At the same time, B.J. Freeman, who was at UCLA, started diagnosing high-functioning autism, and that there was kind of this play between neurology and psychiatry. Oh, B.J. Freeman, she diagnoses everybody with autism. If you want an autism label, just go to her. Well, she was at the forefront of that at that time of, hey, there's milder versions of this that we should be diagnosing. And when I left medical school, that was just happening. We're now just finally diagnosing Asperger's. We're finally getting into that.
So talk about Asperger's. Someone else who mentioned Asperger's earlier. So where does that land on this spectrum? Is
there used to be all these labels, PDD. There's all these labels. Now we're just saying autism spectrum disorder. So Asperger's was supposed to be a mild form with no language impairment to begin with. Now they're like, oh, it's just all the same thing. Just little mild variation on a theme of. But the adult community of individuals who were diagnosed with Asperger's have held on to that title because these aren't just kids. These people grow up. And a lot of these people grow up into very functional adults. So they are self-identifying as, quote, Aspies.
Yeah, well, I'll throw this out there. Yeah, my father, late 60s, says, I think I have Asperger's.
Right.
Should I send him to your...
Well, so he probably does. I mean, it probably does. He's figured out how to live through life.
He's made it this far.
He's made it this far.
Yeah.
The most, stereotypically, most adults with Asperger's, adult men say, well, in my 20s, still, school was horrible. And then my 20s, but by my 30s, I figured it out, and that's when I got married and had kids. So there's all these studies. Advanced paternal age causes autism. Advanced paternal age.
Causes
and that's the issue. So advanced paternal age. Well, it correlates with it, but I don't think it's the cause. And so that is...
46, we just had 2 kids.
Uh-oh.
Yeah, right. Yes. No, another revealing bit about myself. I mean, I was a counter. I was somebody who would, like you say, line things up. I would count things. I would turn the alarm on and off, multiples of 4. That was my favorite. 2 was my favorite number, but then I learned about exponents, so 2 squared had to be better. So I love 4. And once I learned about OCD, then I started to identify with it, and then I started to challenge it. And so just the knowledge that it existed led me to make some changes.
Right.
So,
well,
if I go to the gym, I'll do 11 sit-ups instead of some multiple of 4 or something like that.
Just to be a rule breaker.
Yeah, so I can do it.
So I was on a radio show with Dr. Cronin, who runs the UCLA Autism Clinic. And it was a commercial, and the guy said, hey, what's the deal with autism? What really causes it? Well, there's all these beliefs, and at the Autism Center, we don't care about that. We care about providing services. We do not want to divide the autism community by arguing little things that we can't change. I said, but it's looking like the literature is showing a very strong genetic predisposition, and it almost kind of looks like inbreeding, in that you take two systematizers, two people with a lot of OCD, or two mathematicians get married, have kids. A lot of autism is related to a genetic component. And I said, but it's kind of like inbreeding, but don't say that on the air. That's really offensive. And so we got back on the air, and he asked Dr. Cronin, who's head of UCLA's autism clinic, so what causes autism? Well, it's kind of like inbreeding. And it was very funny to hear that, because that really is, usually families who have individuals with autism have a scattering of those quirky behaviors all through. And you just take bits and pieces of that stuff and you mix it up in a pot, and that's what you get. And at some point, OCD is humorous or fun. At some point, it's no longer functional. So you take what make you excellent at mathematics, but now it's gone overboard, and you can no longer rein that in. And so those traits that now are just a bit too much. And that's what it seems like for a large number of cases.
Yeah. I mean, I apply that rule to pretty much all psychiatric illness. So depression, mania, anything. I mean, once, we all get sad, we all feel manic sometimes, but once it starts to impact, like if you don't go to work, because you were up too late, gambling manically, that's when maybe there's a, psychiatric illness. Or you were so depressed that you couldn't, you curled up in a ball and wouldn't go to work then. That's when you probably have that diagnosis. So I asked you on the phone earlier, I hate to admit it, I was unsure so if you were somebody that was absolutely opposed to vaccines, like that's a hot topic. I mean, do you all have perspectives on this, or?
I can guarantee you this audience has huge perspectives on it.
A variety of thoughts about, vaccines.
I'm sure they do, right.
And so can you just,
sure. Right, and so through the Autism Center, we don't get into that. In other words, if people want to have vaccines, not have vaccines, we try not to argue that stuff, because it just goes in circles and makes everybody crazy. There are scientists arguing that right now, so let them deal with it. So from a medical doctor standpoint, and what I can tell you as a parent of kids with autism, it was easy for me. My son was autistic at birth, clearly. And we have many family members that have autism, looking back. So the current thinking medically is that vaccines do not cause autism. Having said that, though, well, then there's this vaccine compensation fund. Well, why are we paying people for vaccine injury? So vaccine injury does happen. If you take a child with an undiagnosed mitochondrial disorder and give them vaccines, they can have a severe reaction. Those are the people getting paid from the compensation fund. So the teaching is, if you have an evolving neurologic disorder, you should not vaccinate. The literature on autism...
Is there a way to know that?
So the literature on autism is that we should be vaccinating those children. My children are fully vaccinated after looking at all the literature. There's no question I would recommend that. However, there are patients that I'd say, oh, obviously your child has 3 seizures after they get their vaccine. Let's wait a little bit. Why don't we wait a while? I've seen the consequences of the conditions that we're vaccinating for. I've seen measles, encephalitis, something called subacute sclerosing panencephalitis. So measles, it can lay dormant in your system, and it gives you this horrific neurodegenerative disorder in your teens. And I've seen tons of cases at UCLA of that. We put an Ommaya reservoir in the brain, we're injecting gamma interferon. I don't ever want to see SSPE again. So I want my kids vaccinated for measles. But having said that, I saw a child today who has maybe a little autism but seizures, who said he's had these strange periods of regression, and they've come and gone and come and gone, and when he gets seizures, then they're worse. And we vaccinated some, but the last 2, he ended up in the hospital. Can we have a letter of exemption? Heck yes. Not forever. Let's wait, clear this up. The problem is, autism, there is typically an autistic regression. And I think it's to do with whatever is happening in the brain. Development can seem normal till 18 months when there is a regression in development. So parents go, oh my God, they just had their shots. Well, you've always just had your shots when you're a kid. You've always just got your shots 2 weeks ago or a month ago or yesterday. So the autistic regression is known. It is not felt to be vaccine related. So if we have typical autism with an autistic regression, I would still vaccinate, knowing that's the normal trajectory for a lot of individuals with autism. Having said that, I'm not going to argue this with a parent. There are people that have very strong beliefs on this. And through the Autism Center, and even as a physician, I'm not going to argue that. People have very, very, very religious beliefs on this. And it's a point of controversy for many people. But I can just tell what I would do for my patients and for my own kids. You know, I would fully vaccinate.
I thought she was leaving. So. You just stick around. Does anybody want to weigh in on the vaccine topic? Do we have, so what are your, who has kids here, and what are your choices with vaccines? I mean,
I can say something to that. So I have a 2.5-year-old, and he is the one that I'm concerned with that might possibly be on the spectrum. He's not diagnosed yet. We have an appointment coming up with you in a little bit. So, but then I have a 15-month-old who they're like night and day, and from birth, totally from birth. So, you know, I did a lot of research myself on the vaccines, and personally, you know, I agree with that theory of, you know, kids are always getting vaccinated. So for me, I actually spoke with our pediatrician when I was vaccinating our second son, and was like, you know, maybe we shouldn't do all 4 at once. And the MMR, I did all this research, and the MMR was the one that scared me. And, you know, he was like, you're already saying you notice a huge difference in the boys between, you know, your first and your second. And he's like, I respect your decision, but, you know.
And that's the thing. Slow them down if you want. Do
Yeah,
one at a time
so,
if you want. Who cares? Just don't get measles.
I ended up doing them all
Yeah.
together. And,
Right.
you know, my second son is, you know, completely, like I said, my kids they're both night and day. And the little one is, to me, I haven't noticed any difference. He actually just got vaccinated again today, you know, for his 15-month health check. And so, yeah, but, you know, there's a lot of research out there, and it is scary. And
Right.
like you said, you know, when that regression kind of starts to happen,
Right.
you know, and we're like, well, you were doing so good, because like with my son, like I said, he's not diagnosed yet, and his pediatrician doesn't think that he's autistic. He said if here's the top of the spectrum, he's way over here, so he thinks he's very minimal. But we're waiting for an ABA evaluation for behavior services. Like, we got a lot going on. Can't go anywhere in public without anticipating, you know, freaking out. He's very language delayed, you know. So there's a lot of stuff, you know, with that. But, you know, and I still vaccinate him, you know, because those things are scary.
Oh, yeah.
You know, I don't want him to, you know, I don't want something to happen. But then I have friends that, you know, swear that they had an injury when they were a child from a vaccine, and I respect that opinion as well. So I think it just depends.
Right.
is there one vaccine in particular that is considered a culprit, or is
it used to be the DPT, the pertussis vaccine.
Yeah.
Then they came up with an acellular pertussis vaccine, and then the hype and craziness goes everywhere. Who knows? So the yeah, who knows? I don't know what the latest hype is of which one particularly now we're worrying about, but they've all been worried about by everybody. All of the HPV, I mean, you know, everything, all of them have been put into question, because as a parent, you're like, and I think part of that autistic regression is there is a natural pruning of synapses in your brain at that age. And there's thought that possibly you are not pruning, getting rid of the parts you don't need. Kids with autism's head size is often very large. That's extremely common. So are we just not pruning at that age, and then you're seeing the regression because of the impairment that it's causing? Who knows? There's all sorts of theories of why that happens. So does anyone have any other questions? Because
I have to head out because I have class at 6:15, but I wanted to get a quick question in. What is your opinion on diet and autism? Do you think diet pertains to social behavior or language whatsoever?
Let's just repeat the question.
sure. So the question is, come on in. So the question is regarding diet and autism. So as far as diet and autism, that is also an extremely controversial area that can get everybody all crazy and riled up. So again, through the Autism Center, we have about 8 board members. They all have very differing views. They're from very different backgrounds. And so as a physician, as a parent, again, if your child gets sick from eating a food, obviously don't give them that. If they get a stomach ache when they eat whatever, don't feed them that. anything that makes you feel under the weather is going to make your behavior worse. Allergies are going to make your behavior worse. Fatigue, stuff that just doesn't agree with you. Currently, there is no clear cut, and that's right now, proven evidence that gluten or casein-free diets are implicated in autism. That doesn't mean that's not going to come up next week. So personally, my own kids, we did not do gluten casein-free diet because the literature just did not support that and still doesn't support that. But, and then people said, everyone then went, well, what about celiac? What about all these other things? It's very complicated. I don't have the answer. It is so hard to feed a child with autism to begin with that it is such the last thing I'd want to be battling. If you can get healthy food in that kid, it's very sad. I saw a child who once had eaten only Nutter Butter cookies for about 15 years. So like, this child is one big Nutter Butter cookie at this point. And so if you can get any vegetables in that child, any fruits, any meats, try to do your best. I would not make yourself crazy, but if every time you give your child casein or gluten or whatever the food that everybody's worried about today, if it makes your child have massive diarrhea, common sense says don't do that, So, and if you happen to do a diet and notice a dramatic behavioral change, what the heck? If it's healthy, stick with it. So I wouldn't discourage somebody to do it, but I would not encourage them to do that. And medically right now, we don't have any sound evidence that it makes a difference. Does that help?
I mean, that was kind of my opinion on it.
Okay.
I was wondering if you knew any further research.
Not yet.
I've researched it a lot. And,
right.
I'm on like a Facebook autism support group.
Right.
And there's, obviously.
People will swear, yes.
And so many say that obviously, autism's there. It's never going to go away.
Right.
But like that their language drastically improved, after cutting this or that,
well,
or, really increasing this.
I have a woman who I know, who at one of the schools, who I knew personally, who went to Parents Helping Parents when her child was 5 and gave a lecture that she cured her child by XYZ and a whole bunch of strange things. And then he was cured of autism. Well, he is severely impaired. He's still severely impaired. So what you're reading and what you see as a parent too, like, oh my gosh, they're better, they're cured, it's so up in your face. You can't make objective decisions with that. Even Tony Atwood just came out, because I, as a neurologist, I felt bad, like, oh my gosh, I should have diagnosed my own kids sooner, which, I knew there was a problem, but what do we call this and what do we do? Tony Atwood, the expert in Asperger's syndrome, just diagnosed his 40-something-year-old son with Asperger's. And he, oh my God, I don't believe this. And Tony Atwood is the expert in Asperger's. He thought his son was just bad, and it was just, wow. And it wasn't until he watched the videos of his son as a young child that he went, and him and the sister went, he has Asperger's. Oh my God, I don't believe it. Now he has drug abuse and other issues and stuff. But you're too close to it as a parent to really, and that's the help of some of these agencies and other people to bounce it off of. Okay, what do you think? Do you think? Because you're so close, you can't make objective decisions.
You made a statement when we talked on the phone that the Silicon Valley is like the epicenter of autism. I mean, that's true? Like, or are we just labeling it the most?
It's funny. There was an article in Wired magazine talking about, well, at most colleges, when you get up into the PhD level professors, you can go to the college and pick out all the ones with Asperger's or high functioning autism, unless you go to MIT. Then you can just pick out the occasional one who doesn't have it. And that really is that one of the very first books written about autism 100 years ago. Excellent book before any of these crazy theories were out there. They didn't know what it was. Something was wrong with the child. And mother was a history professor at a university 100 years ago. That's strange. Father was a mathematician at the university. And that's very common. So you get people from these backgrounds, not always, who have these traits in the family, and it accentuates it, and then oftentimes you will see that brought out to a level that is no longer functional.
And so bringing it back home to my own life, I have a 2-year-old and a 6-week-old right now, and it's busy. It's busy, yeah. But I would say the hardest thing that we're struggling with is the screen time. And so what's the answer to that in relate? Like, are there some things online that actually are helpful for autistic kids to help them focus, or do you still try to get to limit the screen time for everybody?
It's just survive. It's survive. Don't put your kid in front of the TV for 12 hours. They talk about the good enough parent. If you are the perfect parent, it is not good for your kids. If you're a lousy, horrible, beat them every day, sell meth out of your house, that's not good for your kid either. You need to be a good enough parent. That produces the best results in your kids. So if they rot their brain for 3 hours one day while you lay in bed and read the paper, just don't do that 12 hours a day. Don't do that every day. You need to balance your mental health, their mental health, all of that together and be good enough.
Hear that?
Much better.
But those kids,
That's a struggle.
those
Oh my
kids
gosh.
do the best.
It's like 5 weeks at home. Still not a gene trying to be
Any
But I would
other
imagine,
questions?
I would
Yeah.
imagine there are some online websites that produce videos that are great for autistic kids. I mean, there's a website, by the way, called 20trucks.com, and my kid sings he knows every one of these. I mean, he'll pick an excavator off of the excavator.
Right.
And I don't know if I'm producing the problem or if this is helpful.
It's just, you want some outside time. You want some sunshine. You want to see green trees. You want to go to the beach. You want to, yeah. And then anything you are watching, try to make it relatively educational. Tractors are great.
Yeah.
ABCs, paint by numbers, anything, and there's going to be times, despite your thought that you're never going to do it, that you are going to use it as a babysitter. That's okay.
Oh, I mean, done.
Right. I'm wondering, does anyone have any questions? I want to be sure everybody's questions are answered.
Yeah.
I don't know if you can answer this. I'm not sure exactly where your experience lies, but I've been hearing that there's a difference between young girls and young boys being diagnosed with autism. Do you know kind of what girls kind of display?
Yes. So I have a daughter with autism
So,
who is
let me just
mild.
repeat that question.
So what's the difference between boys and girls with autism? So girls with autism, they think that it's, one girl to every 4 boys, or, 1 out of 4. They're now saying it's probably 50-50 that the girls are not getting diagnosed because their innate social skills are so much better that they can fly under the radar. So it can be very difficult to diagnose a girl with autism. Your pediatrician's likely not going to recognize it. You would recognize it. So I would read information about girls with autism and what that can look like. I've seen girls who've come to me, they're 15, hypersexual because, I figured out how to do that. Or, okay, it's very interesting what that can evolve into when you don't really know what it is. And people read into that stuff of, no, wait a minute, let's back up here. What is this person's functional level to begin with? And so I've seen all sorts of things. We're just starting finally to get those kids diagnosed. But as a parent, you will know there's a problem. Something's not right. And but as far as, I remember with my daughter, I was told, oh my gosh, the behaviorist, she has autism. You need her to get services. No one's ever going to diagnose her. No, I know there's a problem, but no one will ever. No, she needs to be in regional center. Regional center will never take her. And so finally regional center called us. You need to bring your daughter in. Okie dokie. Brought her in at 7. She sat there nicely and answered all their questions. Okay, you guys, yeah, she's fine. Goodbye. So it can really look mild. And, and just realizing that, get with somebody who really knows what that looks like, which is generally a psychologist who specializes in autism. So.
See girls be sensory seekers that way?
I think any.
Did you say?
Yeah.
You said
So are girls sensory seeking? So boys will often crash into you and do those kind of things. My son used to like me to put him under the cushion in the couch and sit on it. And he was, So girls can do that. I don't see it to the same degree. But again, we're not diagnosing those girls. So we're just like we were 20 years ago with the boys. Okay, are we going to start diagnosing them now? So,
in regards to diagnosing, I know that this is that with it being a spectrum disorders, there's many different ones. Is there any specific test or a neurological test, or is it just, you know, a collection of data of behaviors?
Right.
You know, like how do you diagnose? Because my concern is that, you know, I'm getting conflicting information from different professionals.
Right.
And you know, I don't want, I'm you know, fearing mislabeling. You know, I don't want my child to be mislabeled, and you know, but at the same time I want to get him the help he needs. And so how do you go about getting a diagnosis? So,
and your child's two and something.
2.5.
Right. So at, you know, 5, 6, 7, 8, it's very simple. You go to a psychologist. So it's a psychologist with training in autism. And if people need referral, stuff like that, through the contact at slowautism.org, Dr. Ferguson and I man that. Dr. Ferguson has a family member with autism as well, so both of us answer those questions, and we'll just give you a list of people that are out there. So that's pretty straightforward. They use Autism Diagnostic Observation Scale, Autism Diagnostic Interview. And there's a million other techniques, but that's the gold standard for diagnosing autism. But you also have to be trained and know how to interpret the kid's reactions, and so you really need to know what you're doing. At 2.5, I think the only person that I know is Dr. Pegeen Cronin, who runs the UCLA Autism Clinic. She, I think, has enough expertise to diagnose a child at 2.5. The issue is when you come to see me, it sounds like on Halloween, that's what you said.
Yes.
If it looks enough like some autism issues, behavioral issues that are autism flavored, anything, oftentimes I try to encourage people, just write autism on the prescription pad so you can get the behavioral services, because that's the only way you can get them is with that label. Then people say, I don't want it to stick. Oh my God, it's gonna be this record forever. The second your insurance company wants that to go away. The school doesn't want that to be there. Nobody wants it to stick. And so you go to school, they go, he doesn't have autism, throw it away. You know, a report from a world expert, the schools will look at it and throw it away and go, no, that doesn't count. We don't think he has it. So don't be fearful for all these crazy labels we put, because that is typically the only way your insurance will pay for autism services at any age. So we'll go, there's kids with ADHD. Behavior services help kids with ADHD. They help kids with bipolar. They help kids with anxiety. Autism? I'll even write in my notes, I am providing a diagnosis of autism, as I am sure that will enable them to get services, because they need those services no matter what we call it. Yeah. But as a parent, you're like, I really want to know. It's about $3,000 evaluation that your insurance doesn't cover. Can I just have the help? You know, and that's often what happens. I just want the help. So.
Thank you.
What fraction of your day is actually autism versus other pediatric neurology problems?
I worked school hours when my kids were little, and then the rest was autism, at home. But now I'm working 8 to 3, Monday through Thursday. And it's epilepsy, developmental delay, headaches, ADHD, just whatever comes my way. I get a lot of this because I have the resources to refer people to. Not that necessarily every kid with autism needs a neurologist, not at all. But that pediatricians go talk to Dr. Balke. And then on Fridays and weekends, stuff like that, I do stuff for the Autism Center at night. And we're an all-volunteer organization, so Dr. Ferguson's there. There's Lindsay, who owns Monarch Behavioral Solutions, is one of our board members. So all of us work together to create programs that we know need to exist. And that's the fun part. So yeah, most of my practice is typical pediatric neurology, which is a lot of epilepsy. So.
At what level of a kid on the spectrum need to see a neurologist? Like when would you?
Right. So a child should see a neurologist if you think they're having seizures, if facial characteristics or hands, or if you go, something looks like there's something else going on. Like this child, if I saw him walking down the street, something looks off. We call that dysmorphic. That child should see a neurologist. They sometimes will have a specific syndrome we can diagnose. If they're extremely delayed, so if you go, gosh, they're 7, they're not toilet trained, okay, this is odd. That typically is there another diagnosis? Do they have Angelman syndrome, tuberous sclerosis, Fragile X syndrome? Do they have something else that we can go, be careful, you got to monitor their heart, or there's some other health issue with that? So mainly it's epilepsy. And then if you're not getting anywhere with your pediatrician, those often get referred to me. My pediatrician won't believe me. Oh my gosh, just put autism on the paper and get your services, you know, whether it ends up being ADHD or anxiety or it goes away in 2 years or whatever, just to get the help that you need.
So when you say, is it a diagnosis of exclusion or you?
No, so there are specific criteria.
There's behavioral criteria.
So autism is a social and communication impairment. So impairment in socialization in some way, in communication in some way, and they've reconfigured it, and it's more of a psychological diagnosis of, do they have to have repetitive behaviors, and they have to have X number of these characteristics, and you can have some but not others, and that's what a psychologist does. They're the ones that take all that and decide officially, where are you on the autism spectrum. It's about, like I said, it's an expensive process. So, and it takes several hours.
But not every kid has to have an MRI or blood tests.
So we do not do MRI scans for autism. We do them for severe intellectual delay. Or
dysmorphism, as you said.
Even if they're dysmorphic. We do genetic testing for autism. About 25% of the kids, you can find an identifiable genetic mutation. Most of those who go, I don't know what this means. It's brand new. I've never seen it before. I wonder if it relates to autism. So the technology is so new now. It's called Genomic Microarray. They were getting results. They say equivocal. We don't know what it means. Past that, something called whole exome sequencing. So it used to be you could check your chromosomes. You had 46 of them. If you had a whole extra one, you had Down syndrome. Then the Genomic Microarray, they're looking for 1.8 million pieces of your genetic material. Wow, that's much more sensitive. So that's the one that has a 25% chance of picking up a reason. Past that is whole exome sequencing. It's about $6,000. My kids have not done that because it's $6,000. It checks every single piece of DNA you have. The ones, there is something called the Simon Spark study, and they're trying to collect 60,000 families affected by autism, doing saliva samples. I think they are doing whole exome sequencing. And so we actually submitted to that because a patient said, oh yeah, I did that. They're still open. So they may still be out there able to do that. I haven't gotten anything. I know my son has a tiny mutation that they don't know what it means. So I know they're gonna pick that up. Of course, I haven't heard anything. So I don't know where. I'm thinking 10, 20 years from now, I might learn something. So
What is that called?
Genomic Microarray is the one blood test, and then the Spark study through the Simon Foundation.
I have a question in regards to that as well. I did in vitro fertilization for my first, and we did 3 rounds, so we had a lot of testing, and I did have some chromosomal testing done on myself.
Okay.
So would that be helpful to bring to my son's appointment?
It would, to see what they've done.
Okay.
Yes. Yeah.
Because I know there were I think they tested for 5 or 6 different things for me, and there was a blood clotting issue that I had, which was keeping me from getting pregnant. And
Okay.
So, yeah, stuff like that. But there were some.
I would bring it, but probably it's not going to have been a microarray in any way.
Right.
Fragile X screening is another screening that we'll do. If your child has a lot of big white spots on their skin, something called tuberous sclerosis is associated with autism. So if there's other stuff other than just autism, then that typically would, but a pediatrician should pick that up. Everybody's got 1 or 2 white spots or 1 or 2 dark spots, but if you have tons, that can be a condition associated with autism. So
Is testing for Fragile X something that you kind of standardly order?
Yes. Okay. So anyone who comes in with a child with significant, where it's clear, or if, boy, you know, there's enough going on here that I would think no matter what the issue is that we would pick something up. I'll do Fragile X, chromosome analysis, and if that's normal, they automatically send it to the microarray.
And that's why I was asking, because I believe that Fragile X was something I was tested for as well. Because I know that I'm doing some reading on females being the carrier and that sort of things.
Right. And I was tested as well when I was pregnant, or before I was pregnant, because I have relatives with autism.
Can your child have Fragile X without the parent being without the mother being a carrier?
So if the father has it, you'd probably know if the father had it. So, but you never know.
And I'm not even worried about it. I guess it's just grabbing at straws, you know. It's
right.
Us parents trying to do all our research for our kids.
Right,
you know?
right.
But we're not doctors.
Yeah.
Oh, even for doctors, it's
Oh,
Right.
exactly.
I mean, how often does the label come from a pediatrician, or do they say I suspect and then send everything to you?
You know, if you got to get an honest answer from your preschool teacher, they could tell you. So your preschool teacher, your kindergarten teacher, your first grade teacher, none of them dare open their mouths because the parents become irate for some reason. My teacher, how dare they? They told me they thought my child had autism. I was so offended. They're not doctors. I hear that over and over and over again. But truly, they can pick them out. I mean, in the waiting room, my receptionist, oh, this one has autism. Thank you. Okay. I mean, you know, it's when you're around kids enough, it's pretty obvious. And I mean, you could be wrong, you know, but just that's your gut sense. So usually the people who really know what's going on are those teachers. So I would ask them, hey, do you think they have autism? Do you think there's an issue? Do you think this is, basically, do you think there's an issue with the behavior? But the pediatricians, everybody's so careful because we used to just call it quirky. And yeah, you suffered through school and you muddled through and you got out and you found your way. Now it's, gee, people don't have to actually be that miserable in school. They actually can get some help and make life easier. And so we are providing that diagnosis a lot more than we used to, definitely.